Good morning, and thank you for joining us for this segment of Live Healthy. I'm your host, Lauren Collar. When you hear tennis elbow, you often think it's an injury associated with playing the game. But did you know you could suffer from tennis elbow without ever picking up a racket? It's true, and joining us to tell us all about it today is Dr. Keith Santiago, an orthopedic surgeon here at Somerville Medical Center. Thank you for joining us. Starting with tennis elbow, what is the medical definition?
So tennis elbow refers to a condition called lateral epicondylitis. It refers to the fact that people have pain on the outside of the elbow. It typically develops in individuals between the ages of 40 and 60 years of age. It's usually due to a subtle muscle stretch, muscle pull, even a small tear. For individuals, they have a lot of pain associated with this. Typically, it's something that may have occurred to the patient a long time ago when they were younger, but the body doesn't heal or rehabilitate itself as well as it used to, and people suffer from chronic, long-lasting pain. But the good news is that the majority of individuals within 6 months will have this resolve itself. If
it doesn't resolve itself, what's the next step? When do they need to come see you?
Well, anytime that an individual is having pain that affects their activities of daily living, I think that's a good time to see me. Certainly if it interferes with their day-to-day activities, I can provide solutions both non-operatively and operatively to make this thing resolve itself.
Speaking of solutions, what are the options?
So the options are as simple as modifying your activity in terms of how you lift things so you don't put as much stress and strain on your elbow muscles and allowing them to heal. You need to do some simple things like heat or ice, topical rubs, anti-inflammatory medications, therapy, injections, braces. When finally all that's failed, the last option is surgery.
Tell me a little bit about the surgical procedure.
Well, the typical surgical procedure involves making an incision on the outside of the elbow, getting down to that diseased tendon, and only removing that portion of the diseased tendon that isn't healing itself and scraping the bone to help the body regenerate itself. It's a 60-minute procedure, in and out. A more newer, more minimally invasive approach to treat this is something that has been rolled out recently that I do here at Somerville Medical Center, where I use ultrasound to localize the diseased tissue and only make a small stab incision to suck out the diseased tissue and to stimulate the bone to help the body regenerate itself.
All right, thank you for joining us, and thank you for being here for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.